I think maybe without further ado, we're gonna get going. Hoping everybody's ready. And so I am actually not going to introduce the panelists. I'm going to have them introduce themselves. Um, so I'll turn it over to Tim Beck, who's going to be our first panelist. And Tim, go ahead.
Hey, thank you, Ron, and welcome everyone. Thank you all for joining us. Very special thanks to Ron and Zoe for organizing this, and Mad in America more broadly for hosting this webinar. It's an honor to be part of this conversation about madness and mysticism with my fellow scholars and activists. To provide a little bit of background on this webinar, just to give you a sense of where we're coming from and how this came together. Justin Carter, who has long served as a science news editor for Mad in America, was kind enough to invite me early last year to be part of a planning committee for a conference that is being organized by the Division 24 of the American Psychological Association. And this association is the theoretical and philosophical division of the APA. Justin is currently serving as the president of this division, and he shared his plans with me to center this conference on issues related to mad studies, mysticism, and the reenchantment of psychology. And as he was sharing these details, I quickly became very excited about the possibilities and the implications, not just for this division or the APA, but for the field of psychology in general. And so the conference will be held at York University, and our goal is to include perspectives beyond psychology, beyond academia, even engaging with local art and activist communities in the Toronto area, which, as many of you know, I'm sure, has long been a hub for mad activism and scholarship. As many of you in the audience are well aware, psychologists have had a pretty horrific track record with experiences that fall outside of the social mainstream or the status quo. This includes engaging with people who have been traditionally considered mad or have otherwise been diagnosed with mental disorders, but also in studying religious or otherwise mystical or inexplicable paranormal experiences that don't fit neatly into established psychological categories and models. Outside of a few bursts of interest in psychedelics during the 1960s and the recent emergence of interest in psychedelics, this has largely been the case, since William James wrote his Variety of Religious Experiences over 100 years ago, right? So, as someone who's been on various sides of this issue, working in community mental health contexts during my 20s, receiving mental health care throughout much of my adult life, completing my PhD dissertation on the history of the biomedical model of psychiatry a decade ago, I know firsthand how dysfunctional the American mental health system is. Given our privatized healthcare model and all of the issues that come along with that, as well as a range of other problems that we could go on and on about, right? Yet I'm also aware of the incredible diversity of rich, perceptual and sensory experiences that have been concealed by the medicalization and the individualization of madness. And that's, what struck me most, both working in a mental health context and being on the receiving end of services, is how problems become individualized and the social context is reduced to individual deficits. And so these experiences continue to be marginalized or reduced to deficits under the current models of mental health care. So last fall I began teaching in a PhD program in integral and transpersonal psychology at the California Institute for Integral Studies. And here I was given my first opportunity to teach a course on mad studies. I was fortunate enough to have Manvi in the course, who will speak just after me, and we read the work of Wouter, who you'll hear from shortly as well. And in our shared engagement with his text on the philosophy of madness, which I think he'll speak to, and others in the history of mad studies, we were able to map some very fruitful, interesting overlaps between madness and mysticism that I'm sure will be highlighted throughout our conversation today. So I'm excited to hear what others have to say about this. But I wanted to share that, after we started planning for this webinar, I reached out to Wouter to ask if he would consider joining our conference in York as the keynote speaker, because his work has been so influential in this field and these overlaps between mysticism and madness. And it turned out that he was in the process of planning a conference in Europe on madness and mad studies that was scheduled for the exact same dates as ours, May 14th to 16th of this year. And I thought this was just, like an unbelievable synchronicity, right? It's a sort of direct reflection of the overlaps between madness and mysticism, that on two different parts of the world, there were groups of people who were thinking, let's organize this conference and around these issues because these are so timely. So once we realized this coincidence, we agreed that this webinar could serve as a useful platform to underscore why madness is such a relevant concept, culturally and politically for so many people today, particularly given, the horrific events going on not only in the United States, but around the entire world. And so this is just one of many important threads uniting our conferences to each other. So we're hopeful that today can serve as sort of a forum to connect, these ideas from different parts of the world, but then also engage with you all as I can see, all of you are from different parts of the world as well. So this is an excellent international representation of ideas related to madness and mysticism. So I'd like to pass the conversation along to my co-panelists. I'm interested to hear, what they have to add about these topics.
Yeah, so Manvi, go ahead.
Thank you so much, everyone. I'm really grateful to have this platform. My name is Manvi Singh Bogan, and I prepared something in a written form. So I'll go ahead and read it, which I'm hoping gives a good introduction to my personal relationship and professional relationship with the topics of these conferences. So I am Punjabi American, and I'm a doctoral student in integral and transpersonal psychology at the California Institute of Integral Studies, and I currently work as a professional interfaith clinical chaplain, also called a spiritual care provider, and I'm currently working in a hospital setting. I also self-identify as a mad mother and mystic living with mental illness and an addict in recovery, managing my psychological stability holistically. I'm a certified yoga and meditation teacher, writer, poet, and artist. And I come to this topic both with continuously unfolding life experience and personal and professional interest in expanding the field of psychology to allow for more of what I know to be true about being human, mental health, and healing. When I first encountered mad studies in Dr. Beck's class, I immediately felt a connection to the field and a calling to be part of it. I felt like I was finding my people after managing my own mental health holistically for over a decade, just on my own, after the current mental health system in America failed both myself and my mother, who has been severely mentally ill throughout my life. I became a chaplain after realizing that the counseling psychology master's program I was in was not providing information or skills consistent with my personal or cultural ideas of what it means to be a person or what psychological healing looks like or entails. One of my mentors told me that my relationship with my parents was codependent when it actually was considered healthy in my cultural context. That was the first time my cultural norms were pathologized. I went into counseling psychology to become a therapist for South Asian Americans, but I didn't feel that what I was learning applied to my community. Even in seeking out my own therapy, I sought care from therapists who were available and covered by my health insurance, who held the same biases, beliefs, and values that contradicted mine and didn't know how to hold mine with respect. I also tried studying psychology in my undergraduate studies, only to find that Psychology 101 was literally a biology class, and I switched to majoring in literatures of the world as a way to learn more about the truths of the human experience in a more true form. I found that literature, religious studies, and poetry held a more honest and complete picture of what it is to be human. Now studying integral and transpersonal psychology, I have finally found a field within psychology that allows for more of what I know about being human, health, healing, illness, and our potential. I am a psychiatric survivor who has been diagnosed with major depressive disorder, generalized anxiety, and complex PTSD from childhood trauma and abuse. After over a decade of attempting psychotherapy by various providers with various methodologies, some of whom injured me further, I was ultimately healed the most by the path of yoga, as taught by my teacher from India, and the many mystic experiences that accompanied that path. In some meditations, I received visions of key moments in my life that I didn't even remember consciously, but they came into my mind's eye as if printed on a postcard. They'd be held up in front of me and then they'd disappear. And when I came out of the meditation, I felt emotionally, mentally, physically free of those experiences that were just lodged in my being somewhere. But no other methodology had been able to access them. So, yoga and meditation are still part of my holistic mental health maintenance, which has sometimes included medication and therapy and sometimes not. I became a mother during early pre-vaccine COVID-19 in May 2020, in the time that we didn't know if anyone would be allowed with us in the delivery room. When my world was falling apart in postpartum depression, there were no therapists available. And I now understand my postpartum depression as a psycho-spiritual process of me becoming a mother. It was a process of a spiritual death and rebirth for me. And I understand my postpartum depression to be a normal response to that process. So when I was in the throes of that depression, I reached out to women that I barely knew in a breastfeeding support group, and I experienced the power of community care. Since then, I've been part of many women's circles, and these have healed me psychologically and spiritually, and even physically through the alchemy of group healing. And now that I'm engaged in 12-step recovery programs, I've also experienced what I consider to be miraculous group healing that would have never happened in one-on-one sessions or on my own. So managing my mental health also has a huge influence over the way that I mother my child, which is why I call myself a mad mother. It informs choices such as if I work outside the home or not, how much time I spend with my child, and what fights I'm not willing to have so that we can maintain peace. My complex PTSD was triggered often in her toddler years, and in those moments, I immediately felt myself transported to being a toddler again. I would curl up and cry and not be able to function for several minutes, and my partner would take over. Or if he wasn't around, we would simply skip activities like brushing teeth or putting pajamas on. We also spent a lot of time on the weekend at the zoo or other outings because I couldn't settle down enough to pay attention to her at home. And I've simply had to find lots of workarounds to manage my mental health, but also show up as a mother. Being a mystic mother, I also feel like I have a connection with my daughter that goes beyond words and deeper than simply intuition. I can feel her even when she's far away and discern her needs before they are expressed. I'm convinced that the same sensitivities that make my psychological stability vulnerable also give me access to these intuitive spiritual gifts. And that embracing madness and mysticism, one day the field of psychology can offer us a way to hold these dangerous gifts that honors the gifts while also protecting us and others. For me, integrality is central to my concept of mental health, madness, and mysticism. I've been attending the California Institute of Integral Studies on and off since 2012, and I've been a serious yoga practitioner since 2013. And both of these schools teach about the interconnectedness of mind, body, and spirit. I see mental illness and physical illness as a call from the spirit towards some healing. Even when my patients, whom I see as a chaplain, do not survive their health issues, I'm convinced that there was a spiritual message or psycho-spiritual growth potential within the physical illness. I have watched the growth process unfold for patients, both those who survive and those who die from their illnesses. Growth potential within physical and mental illness has always been the case for me, as I also manage my autoimmune disease and mental health holistically. I treat these illnesses as spiritual guides, and I do my best to discern what messages they have for me. Often, of course, the current mental and physical healthcare system advocates for medicating symptoms, numbing them out, not addressing the root cause, and ascribing no meaning whatsoever to why we got these illnesses in the first place. I have chosen a different path from the conventional medical models, and I've actually reversed my autoimmune disease when I was told it was impossible. I live with severe depression without medications at this current time. I'm open to it if I need them in the future, but I believe that this other path has been much more effective for me. So my current interest is in bringing the spirit back into awareness in a healthcare context, both for physical and mental health issues. I'm glad that some of my patients and some medical providers actually already reference the mind-body connection, but we're still missing the spirit connection. I consider myself to be mad, not only because I have diagnosed mental health disorders, but also because of the way that my work with death and dying as a chaplain has shaped me and my energetic and spiritual openness, which has led to many mystic spiritual experiences. My depression itself has been a guide in my life, always ensuring that I'm on the right path with the right people and following my soul's calling. I have also had many fascinating healing experiences in meditation and out of body experiences. I believe that looking at intergenerational trauma is critical in mental health work, both the ancestral traumas we are aware of and those that we're not aware of. And I believe the body holds a lot of information that's relevant for our psychology. So I don't believe in a mental health model that leaves the body out of the equation. So many of my varied mystic experiences include communicating with sacred sites or beings that normally we don't think of as communicating. For example, I was hiking in Sedona when the mountain talked to me and gave me an important message. And when I was struggling with infertility, my friend's dog telepathically sent me a message that I needed to get a dog before I could have a baby. And I did, and it worked. And I'm convinced that that was a real thing that I experienced. I think that part of being mad and living outside of established states of mind is being more open to spiritual messages and guidance, which has been a true gift for me. I've often felt that even my depression is a gift, and the insights that I get are born on a sea of tears. My depressive episodes are often times in my life that I need to make a pivot, and when I make a pivot, tremendous growth happens and good comes into my life. So that's not something that I personally want to numb out unless I'm not able to function. Depressive episodes almost feel like a ritual to me at this point. I know when they're coming on and I know how to move through them. I always receive some spiritual guidance in the middle. I've also had experiences that were not so pleasant in my mental illness, such as hearing voices that are not helpful. Like in some of my suicidal depressive moments, I felt that I was in a steel cage and I couldn't connect with anyone in the real world and I wasn't really there, but there was hateful voices echoing at me. So I'm also understanding that there's a lot of experiences that are not pleasant and not necessarily for our spiritual growth. Overall, I believe these two conferences on madness and mysticism and reenchanting psychology are vital efforts to continue to expand the field of psychology and psychiatry, to expand our understanding of what it means to be human, what's the range and the value of various human experiences, redefine illness, health, and healing, recognize the spiritual and mystic potential of mental health issues, and provide more holistic guidance, options, and support for people experiencing mental health issues. I believe that our understanding of madness and mental health needs to shift. Many of these states can be normalized to life experiences such as having a baby or losing a loved one or going through other major transitions in life. These could be managed holistically prior to someone's life being endangered. One important difference for me is that mystic experiences are full of love, light, reassurance, comfort, and peace, while psychotic experiences can often not be pleasant at all, or sometimes it's a mix. Some of my patients describe battling with evil spiritual entities, and as a chaplain, I believe them, and I can support them in processing that experience. That is so much more healing, I find, than being someone dismissing it because it doesn't belong in this material world. I remember that I saw a patient who was diagnosed with schizophrenia who was a truck driver and drove his truck into a building. That is a very dangerous thing, of course. And so there's also a balance between finding safety and survival and honoring whatever gift is within that experience of that type of psychosis. Another one of my friends, a brilliant artist, was diagnosed bipolar, unbeknownst to me, until I found her in a manic state, jumping on cars and throwing pots around her kitchen. She seemed not really to be there. When I looked in her eyes, she was somebody else. She wasn't really there. She couldn't really hear me. She was really far gone in her mania. I ended up taking her to the emergency department at the local hospital because I had no other way, I felt, to save her life, but that felt like a solution that fell short. I also wondered if her creative genius was accessed from the same place in her being as the mania, and my instincts tell me probably yes. So I agree with the mental health issues being framed as dangerous gifts within MAD studies. Being mad and being a mystic and being different are gifts in a way when one can learn to manage them to the place where one can function and survive. I often find that these cracks in ordinary consciousness can be rich with potential. Thank you.
Thank you. That was really great. You shared a lot. I think I'm gonna have to listen to it again to absorb it all because you made a lot of great points. It's amazing. All right. Well, moving right along, Chris, I think you're up next, and so introduce yourself.
Wow, that's so much to follow. I mean, beautiful. Oh my goodness. Um, that vulnerability is so it really it really got to me. Um, yeah. Hello, everybody. My name is Chris. I use they, them pronouns. Um, and I would also consider myself to be someone who is mad. I consider myself a psychiatric survivor. I have a lot of experience within inpatient psychiatric units being institutionalized. That's where a lot of my research stems from, and a lot of where my academic interests stem from. So, a little bit about me. When I was an adolescent, I was institutionalized multiple times and experienced a lot of mistreatment from staff, or witnessed a lot of mistreatment from staff, that as I became entrenched in academia, I wanted to formalize into words, into writing, into art, and to put those memories into writing. So right now, a lot of my current research focuses on tracing the US's carceral history to our current ethics regarding coercive measures in psychiatric practices. It's US specific for a reason, mostly because I'm in the US, but also because the US has very different standards of ethical care compared to the rest of the Western world. So, my goals are mostly to reassess our understandings of if coercive measures such as seclusion, sedation, restraints are ethical, and if it's actually being practiced to its technical limits. Any technical manual on mental health nursing or being a staff member within these psychiatric units will tell you that coercive measures and restraints are meant to be last resort practices that are used for the benefit of the patient. But speaking from anecdotal evidence and from the memories and experiences of my many, many peers, that is simply not the case. So I really hope to bring light to the realities of how coercive measures are used within the psychiatric institutions. Let's see. As a young person, I am 21. I am nearing the end of my undergraduate career within John Jay specifically. I feel a responsibility to speak to those experiences that I had in childhood and adolescence while those memories are still fresh and while I still embody those experiences, while also learning how to amplify the voices that might resonate with my experiences from children, from young people, as time passes. Um, I was introduced to Tim, then Mavi, and then Koosters, and then Ron, through one of my professors at John Jay, who teaches critical social psychology. Up until that point, I was engaged in psychology mostly for the sake of getting to a point where I felt like I could have a voice in academia to express my experiences in a formal way. Um, but after meeting my current mentor, MHA, uh, they introduced me to a field of academia within med studies and critical social psychology where I could actually feel like I belonged and shared experiences with the people that I uh, share an institutional environment with. I was introduced to Tim that way. I was introduced to the conference of the APA division that way. Um, yeah, and it's been so rewarding to meet so many people who have had very similar experiences to me. I think Manvi, your experience as with like mysticism specifically and spirituality really spoke to me. Um, one of the very few people I remember having a positive experience or a healing experience with within these inpatient facilities was actually a pastor. Um, and it was unexpected as somebody who is not familiar with spirituality and mysticism outside of um, the US's understanding of Catholicism and Christianity. And it was a stark difference of how he validified my experiences and my health and my wellness compared to the staff that were clinically trained to do the exact same thing. Um, I found a lot of healing and within spirituality and nature. Um, and I've had a lot of time to reflect on mental health professionals who were very much not helpful to me, who would tell me things like, I believe that you believe that, if that's a familiar term, or phrase that other people in the mental health system have heard, or why do you care so much in regards to family members or close friends or people within my community, um, and learning how to fight back against that in a culture that uh, is more individualistic than the collectivist culture that I come from. Let me see. Is there anything else? Mm-mm-mm-mm. Um, yeah, that's just a little bit about me. So I'm just kind of getting started in academia within this field, but I've lived that experience for a very, very long time. So yeah.
All right, yeah, it's great to hear. It's great to hear like young people coming in and actually getting guided into some interesting areas and bringing their own passion and and for the work. So yeah, great. So um, Wouter, I guess you're the next one up. So feel free to introduce yourself and get going.
Okay, hello. Well, first of all, thank you, Ron, Tim, Manvi, and Chris for your wonderful talks and narratives around these things and the domains and regions of the minds we visit now and then. Um, well, how I came here in this Zoom meeting and in this whole field of med studies or whatever we call it, is that I've also had, or I've also been suffering from psychosis several times in my life. And at the same time, or in between those periods, I'm also a philosopher. And I philosophize, so to say, about my psychosis, and I try to explore these experiences. What are they? How what are the ways that they are navigated, and so on and so on. And that's led me to writing a book called A Philosophy of Madness. It's hard to summarize it in a few words because it counts about 700 pages. But it is about philosophy, about madness, about the intertwining of them. And an important role in it is the ineffability or inexpressibility of what it is all about in psychosis. Well, spirituality is, of course, one thing, but it also comes very close to mystical problems, to say what is actually there, what is actually going on within us, what disappears when we give it a name, etc. Oh, before I have a little text also about this Mystic and Madness interface. But before that, well, my book was published in 2014 in Dutch, and then it got translated into English in 2021, I think. And my book was received a kind of book presentation with a conference with it in 2021, and that was the first conference called Too Mad to Be True. And then I related to a group of people, among them Stijn van Heulen, who's also in the chat I saw, and other people in Europe who are interested in these, well, approaches towards madness and expressions of madness and how to talk about this. And then that was the first conference. And that was quite a success. So a second, a third, and now the fourth is approaching, and it is a kind of gathering of people who are all encircling this madness experience, whether it is because they have experiences of madness or something that is like madness themselves, whether they are spiritual caretakers, whether they are psychologists, psychiatrists, whatsoever. So it's all around. We all group together around this notion, so to say. And med studies is in a way of studying this in classes and reading texts together, etc. Which we also do as philosophers. But okay, I see in the chat, what's the name of the book again? I think Zoe has a kind of link to my book. It's called A Philosophy of Madness and came out at MIT Press, and the link will pop up. Oh, there it is. And now I read a little from my book about this interface between madness and mysticism. It's about 10 minutes. So, okay. Mysticism slips through your fingers whenever you try to grasp it. Mysticism is the teaching of the hidden that keeps itself hidden. For when we cling to it, it dies. When we try to form an image of it, it melts. When we begin talking about it, it falls silent. It is the black hole in which thought loses itself. Mysticism and madness are both concerned with truth, with a different kind of truth than we know from science and epistemology. The mystic and mad truth have to do with an insight or an overwhelming experience that is beyond ordinary reflection and articulation and is of great and inexpressible importance. It is true because it is indisputable. The mystical counterpart to scientific discovery is mystic or religious, so-called revelation. Mysticism and madness are located outside the workings of ordinary life and an ordinary shared language. Mystics and madmen or madwomen search for their truth by detaching themselves from the communal world. So there is a sense of extreme individuality where you even lose your identity as an individual, which separates you from the community. And having experienced all these separations, we can form a community again, of course. But that's mysticism and madness have a problematic relationship with images. It is difficult to capture whatever is seen in enduring, clear-cut images because of the non-communal nature of this kind of seeing. Yet both mystic and madman and madwoman rely heavily on metaphorical language and imagination in order to help others understand what is going on. The same problem occurs in the area of language. Mystics and psychotics, for me that's equal, psychotics, madwomen, madmen, cannot express their particular viewpoint in the shared language of the community. Indeed, ordinary language is fit only to express and refer to shared experiences and phenomena accessible to everyone. Nevertheless, mystics and madmen often express themselves in language anyway. And the mystical mad process can easily begin, it can start with a flow of words. Another theme that mysticism and madness have in common is their different way of thinking. It is often said that in order to comprehend the truth and to penetrate to the domain of mysticism, ordinary thinking has to stop and be replaced by something else, another way of thinking that cancels out any disunity or division between the thinker and the object of thinking. Men often speak of a sudden transition from everyday thought to a way of thinking in which thought, perception, and creation are one seamless whole. Mystical and mad truth is an impressive, true experience of an all-embracing solidarity in unity. When borders evaporate and opposites are transcended, mysticism and madness may result in experiences and mirrorings of a supreme unity that is sometimes called God or the Absolute. Another characteristic of the mystical experience is a sense of infinity within the unity. And the final aspect of mysticism may seem like the opposite of the others to which Manvi also referred, that of the emptiness, perhaps the negative, or the void. Gazing and staring into the being of infinity, contemplating the passing of time and eternity, one might also come to realize that everything is actually nothing, and that this miracle of absolute nothingness is that within which all positive existence rests. Now I will address, I sketched some aspects of this mysticism madness interface. Now I want to conjecture 4 possible ways they relate and how do they differ. Because there are 2 terms and they are used in different contexts. Well, a first possible difference is that of the context in which the 2 terms are used and the history and tradition from which they stem. The term mysticism comes from the history of religion, has long been connected to religious practices, meditation, and contemplation, and is usually discussed in a context having to do with things like belief, religion, or theology. Terms like madness and psychosis are much more strongly associated with having an illness, displaying disturbing abnormalities in social contexts, experiencing things that are said to be not there, so-called hallucinations, and thinking thoughts that do not make sense, so-called delusions. In many cases, however, a similar complex of experiences can be described with terms like morbid, deviant, incoherent, disturbed, and fragmented, as well as with words like lucid, serene, profound, poetic, and transcendent. For example, a good friend of the person having the experiences or the person herself may opt for the second group of terms, mystical, as Manvi did, while the attending psychiatrist prefers the first, the psychopathological. Even the person themselves may vary in their descriptions. In discussions with an insurance doctor, they might speak in medical terms. Why not? We have this medical jargon, and we also need that. But when telling stories having to do with the ups and downs of their experience, they might use mystical language. So this is the first possible difference, that it's only a difference in language. You use one for one context and the other for the other context. A second possibility is that there's a real difference, but that this difference does not lie in the experience itself, but arises because the consequences are different. Perhaps the experience is essentially the same, but whether it leads to the misery of madness or to the enlightenment of mysticism depends on how you deal with it. Perhaps the structure of mystical and psychotic experiences differ only by such factors as the extent to which they are believed, how and much they interfere with one's life, and the emotional impact after the experience. So the second possibility, how do you react to it? How does your environment react to it afterwards, while the experience itself on the moment or the time period itself may be the same? Well, the third possibility is that there is an intrinsic difference between the mystic and the mad experience. also possible. The psychotic experience is claimed by some to differ from the mystical experience on the basis of, first of all, that in the psychotic experience, a maintenance of the ego structure is, albeit in a distorted or fragmented fashion, and a concurrent maintenance of some subject-object distinctions in the meta experience. Secondly, that in the psychotic experience, in contrast with the mystic experience, it is said that there would be less ability to control attention. And thirdly, less ability to maintain equanimity. I do not know how you pronounce it in English. Equanimity. Demonstrated by emotionality, confusion, and anxiety. And then when someone looks confused and looks anxious, it may be a psychotic experience. While when someone looks at the outside serene, it may be a mystic experience. That's the third possibility. It is often claimed that the mystic is better prepared beforehand for what is awaiting them, and that they find it therefore less overwhelming and can succeed in putting the event in perspective. Because the mystic is better prepared, and some cultures are better in these preparations, of course, some cultures or practices, religious practices or whatsoever. Because the mystic is better prepared, the quality of the experience may be different. They are able to let go of their ego, are more confident about letting themselves go, and doesn't put up any resistance to what is happening. They endure the experience passively where desired and guide the experience actively where appropriate. The madman is not yet ready to undergo such experiences, or there's simply no one nearby to guide and support them and to convince them that they are heading in a good direction. At some point, the madman is distracted from following the right path and lets himself be tempted by power, selfishness, or pleasure to become entangled in delusions and hallucinations that are characteristics of madness but not typical of mysticism. Well, that's the third possibility. And finally, there's a fourth possibility. In this fourth possibility, I like all these possibilities, all these ways of thinking about these two, but perhaps I like most this fourth one. Perhaps madness is not an accident on the mystic road, or not a dead end on the via mystica. Perhaps the mad experience is a logical continuation of the mystical experience. In this view, the madman carries on with the journey, while the mystic drops out prematurely, for the very reason that the mystic is connected to a tradition that has prepared them for their experience. The mystic will hold fast to certain assurances, identities, or traditional distinctions, such as the difference between good and evil, and that makes them incapable of penetrating the most extreme domains. The madman goes further and deeper, but also pays a higher price. Many do not return from this transmarginal zone, or so this line of reasoning goes. In this view, geniuses like Nietzsche or Hölderlin end up, in spite of their philosophizing and their poetry, they end up in a permanent psychotic state because of the illumination of their deep truth and illumination of the fire which burns them for good. Well, that's a fourth romantic kind of possibility that the difference is. Okay. Oh, well, that was my 2 pence of mysticism and madness.
Yeah, I think people are very appreciative of that. One question in the chat was they were wondering, since you read a certain amount of text, would you be able to forward just that excerpt to Zoe so that then she could send that on
yeah, sure.
to participants? That would be
Yes.
great, because
Yes.
I myself would like to review it, because some of it I was going like, wow, that's so well said. I've got to remember that. Of course, you don't remember it all so easily. Yeah, so we're going to have some discussion. And again, I encourage you, if you want to have a question for the panel, please put it in the Q&A, which you'll find on your menu. You might have to click the More button at the bottom to find the Q&A, but please put your questions there. And I did say I was going to start off with a question of just kind of like asking the panelists, like Tim, you were remarking on the synchronicity of these two conferences at the same time. But why is this topic of high importance right now? We're curious about your thoughts about that. So I'll just put that to the panel, and maybe more than one person will answer, but what do you guys think about that?
Sure, I can jump in and get started with that. So, maybe just to kind of bring together some threads from what the other panelists have said already. The way that European American culture, and in particular psychiatry, has effectively, individualized and medicalized these experiences called madness. It's concealed this infinitely broad range of human possibilities, and perhaps, most importantly, it conceals those experiences that, as others have mentioned, have long been revered and or ritualized within other cultures and time periods across the world, and as Wouter mentioned, like within lineages of religious or mystical traditions that have honored these traditions and have helped shepherd people through them. And so I've become increasingly interested, through my research on neurodivergence and the history of psychiatry, and how the concept of normal is used to police behavior, and how it's become such a dominant motif in American culture, but I think increasingly, around the world as well, and how this concept of normal isn't only used to police behavior in each other, but we've come to internalize this concept, and we police our own behaviors out of fear of not being normal, which just amplifies any stress or anxiety or intrusive thoughts that one might already be experiencing. And so I've come to really honor and understand the extent to which experiences that are coded as madness or neurodivergence or sit at the borders of social norms and social expectations, and of course, as Wouter and others mentioned, oftentimes go far beyond it. But still, they're at the border of what we often think is possible, and as such, they possess a large amount of power in contemporary culture, right, in contemporary society. Which is why I think that so many people have started using these terms to talk about themselves, particularly neurodivergence and neurodiversity, as I see many people pointing to. So I think I see that as a reaction to this tendency that we have to police behavior and this sort of internalization of normal that I think we're conditioned to play out. It's a sort of ritual of normalization that we're conditioned to play out from an early age. And so I appreciated Chris talking about childhood mental health, right? Like that's something that I'm recognizing with having a 2-year-old, like the extent to which it's like, there's all this discourse about danger, and you go online, you try to find answers about like, what should I do in this situation, and 1,000 people are telling you that you need to control the behavior of your child, you need to keep them from these consequences that could result 20, 30 years from now. And so there's this like risk management language that I connect to neoliberalism, but also I think this risk management language can be seen in other political formations as well. And I think that's what we're starting to see today, that what previously we might have called neoliberalism and neoliberal policy is quickly transforming into something that might be even more dangerous. And I think the concept of normal is being weaponized in new ways. And we see this with, people calling for a return to psychiatric institutionalization, or, the building of camps to send children to if they're not able to, do what they're told. So yeah, I'm very much interested in that. So I see today like madness and neurodivergence like having real potential for people to push back against that sort of forced normalization.
Yeah, yes, I completely agree with Tim, and I think it works on on the individual level for young people who are somewhere in their life, they have certain experiences which become abnormalized by themselves, by others, by psychiatrists. That the problem also is that when they go to the psychiatrist or they get their information in other ways, that they medicalize these abnormalities and that they start to think that those abnormal experiences do have not any meaning anymore, that it is just sick thought. And when something is sick, you only have to get rid of it. And then a certain aspect of yourself, a certain potential of yourself is being split from your person, and you consider this so-called illness as an object, as something that comes from the outside, which overwhelms you, makes you sick, and which you can only have a relation with in terms of medicines. So, and then when you are having these sick thoughts, you are getting trained to have these not anymore, but what those experiences mean in terms of what do they refer to what kind of worlds, what kind of mental or real or in-between worlds, and what kind of power does it have for your formation and development. That is all blocked. Except when you meet someone like what Chris said about the whole system was rubbish, throwing diagnosis, but only this pastor was listening and was valuing your experiences. So when you meet someone, whether it is on this Zoom webinar, or it is when you start to do med studies, or you meet a good psychiatrist with whom you may talk further, or a good peer, or a good so-called expert by experience, then things may change on the individual level.
Yeah. Anybody else want to take on that question, or we could go on to more?
I mean, I think to connect a few points, especially I know in the past we've talked about how the labels of neurodivergency and disability in terms of psychiatric conditions, they've become widely accepted, as like especially among like younger people I know in my generation, saying that you're neurodivergent, that you're autistic, that you have ADHD, or have other labels or diagnoses. It's very commonplace. And the stigmatization around it has definitely been deconstructed enough to the point where we feel like we're comfortable with these labels. That's what I was gonna say. But yeah, I I look a lot into like that need to control and subdue children. I think that the state of childhood to me is kind of a state of like madness in a way. Like it's not something that can truly be categorized or explained or rationalized, and I don't believe that it has to be. But our process of maturing or becoming an adult, the way that we consider maturization mentally, I feel like really dampens all of that really unique and beautiful experiences that we have in childhood that I really want to speak to. I don't think that had anything to do with the original question, actually, but I want to say that.
Now, well, I think it does. I think when these medical diagnoses are in a way numbing people, when there are alternative concepts, whether it is neurodiversity or med studies or madness in a positive, heuristically promising way, when you develop those kind of discourses towards yourself and towards other rigid identities may shift and become more open for the otherness of identities. So I think it was it made sense.
Manby, did you want to comment, or you can if you want?
Yes, I think it's just enough people coming forth and saying we have an interest in pursuing mental health, wellness kind of things, but what we have in place is not working. I just feel like there's been more of that voice. So we're like, okay, well, how can we make it work better for more people?
Mhm. Yeah, and I think we're in very polarized times also, and it's sort of like, should we trust the progressivist, mainstream, or should we go back to something we used to have before, or even brutally go back? And as often it seemed like it's either or of those. But I think the message of madness and mysticism is, hey, maybe it's neither one totally has it. It's something else. We need to keep looking. We need to be. Maybe everybody has bits of the truth, and that kind of thing. So in that case, that is why more openness to madness and mysticism could be important for our culture. But I'm going to go on to some audience questions now, and there's two that might go together, and one has, like, sometimes the word psychosis has been mentioned, and what do people think of that word when they use it, and versus in the medical profession, or for example, when we say suffered from psychosis. Is it always suffering when it's psychosis, or can it be suffering followed from growth? And if there is growth, then can it be worth it to have gone through the suffering? So that's a number of points, but maybe see what that brings up for you.
Yes. Shall I answer that question? Yeah. Well, it's my line of thought, my narrative, so to say, when I wrote my book, I started with that some people are called psychotic, and I've been called psychotic, and I recognized myself in the descriptions of other people who have been described by others or by themselves as psychotic. So psychosis as a referring term has for me no problems. It's kind for me it is kind of a neutral term. The problem with the term psychosis is that it is mainly occupied by medical terminology. That it is psychosis is part of schizophrenia, part of bipolar disorder, or part of whatsoever, and that it draws you into into the doctor's room, and not into the chaplain room, so to say. And the doctor's room, that is okay, that is fine to be there now and then for whatsoever. But there are also other rooms we'd like to visit, and so sometimes I use psychosis just to so people know about what kind of behavior or thoughts approximately I talk about. But in my book I have transformed this term, and I've named it in Dutch waanzin, which is also in German Wahnsinn, and the best cognate in the best term in English is not insanity, but probably madness, which is also different associations than waanzin, but insanity or madness. And with the term madness, I use it as a tool to get to other to other realms of existence, to culture, to film, to make connections in to the communal world where we all find meanings in one way or another. So as a cultural, philosophical, whatsoever, a term outside the doctor's room, and within our common, philosophical ways of understanding.
I
Anybody
can
else
jump
want to
in.
jump? Yeah.
Someone had mentioned also, like, why use the word vulnerable? Because I know I use the word vulnerable, like I have psychological vulnerabilities, and I use that because that is how I experience it. So that is how I'm really big on sort of self-labeling. Like I personally feel vulnerable because it's like I feel like I live in a booby-trapped world. Like as a mad mother, I don't have any conventional treatment right now. It's like any second I might fall into a pit and then I can't do anything. Like when I first had my baby and I just put her down and started screaming, I can't do this, I can't do this, and ran out of my house. Like I was just out of my mind. And that kind of thing can happen to me at the drop of a hat. So I that makes me feel vulnerable. And it's empowering for me to think about how do I protect myself around that vulnerability and honor that it's there, but take such good care of myself that there's less of those booby traps all over my life. So that's kind of where I'm at. And I just with other labels, I haven't been diagnosed as psychotic, but with like depression, I found it really validating to have a name for it when I was first diagnosed when I was 18, because I was like, oh, all of a sudden I had a box where I could put everything in and call it depression. And it actually made more sense to me, and then I could pursue resources for depression to understand it more. So it's been, I think sometimes terminology can be painful and triggering if it's been used to other you, or it's a sign that you've been rejected or cast out, or you don't belong, or you're not good enough, or you're not capable. Those kind of labels can be wounding in that way, but I just think I think self-labeling is important. Owning, that's why I call myself an addict. I will always call myself an addict, and I do that on purpose. That for me, it's empowering. So I think those kind of distinctions sort of matter. So yeah, language is complicated and it's personal.
Yeah, I'd like to jump in and say something about what Manvi just said about like this notion of protection. And I think like it's such an incredibly important concept that I think in sort of European American contexts often gets, misunderstood. You look around the world, you see the way that other cultures have conceived protection, and there have been rituals, there have been religious practices, there have been, very complex maps created to communally protect to protect community members against harm that could possibly befall them. But in the American mental health system, we're so very reactive. Like protection doesn't really exist as a concept, except insofar as we think of medication as protecting someone from relapse. But yeah, within that medicalized language, we're not really honoring what it is that we're protecting ourselves from. We're not really making it explicit, and instead we're just reducing it to this very sterile language that doesn't even begin to acknowledge the depth and the profundity of what protection means in that context, and particularly the community aspect of it. So yeah, thanks for speaking to that, Manvi.
This is such an interesting conversation because I use labels of disability and neurodivergence, even though I know that inherently it creates a difference between normality and it's basically calling myself abnormal. So there's inherent problematic aspects of using those labels, even if I find a lot of identity in it. To kind of go back to the initial question and maybe connect it back to another one that I saw in terms of IFS and internal family systems. Um, I think a lot of us, let me not say that. I experience plurality and concepts of multiple consciousness that might, in medical fields and psychiatry, be categorized under dissociative identity disorder or otherwise specified dissociative disorders. Um, but I don't feel the need to pathologize those experiences, even if I find labels that accurately describe them. I think that the idea of using IFS and internal family systems, and even just encouraging people to uh, I identify with and engage with the idea of plurality and even the idea of multiple consciousness is whether that be in ways that people identify with psychosis or just talking to yourself as an individual person. I found a lot of healing in that. I would love to see uh, that more validity be put into those experiences, whether it be through um evidence-based therapies like IFS, or it be through adjusting our language and explaining it as plurality instead of a pathologized disorder.
Yeah, right. Very important. Here's a question. They say, I'm curious about the roles that have been assigned to the mad and the mystic historically. Over time, the mad and the mystic have been more or less integrated into the societies they've lived in. What is the importance of role and who assigns it in the context of cultural participation? What does that bring to mind for you?
Yeah, it's very difficult question, very huge, broad questions. The history of those terms, and that some experiences or some practices that are called mystical get assumed, absorbed within a tradition, and that within a tradition or certain monastery or whatsoever, that these are being contained, these experiences. That may be the case, but I think madness. There's also lots of madness, which also historically, when we say modernity or liberalism, has individualized and divided us and has no place anymore for these experiences. It is not necessarily the case that a religious treatment of psychosis or of madness has positive outcomes for the person in question. I mean, yeah, well, there are psychosis. There are parts of psychosis which are not very pleasant, so to say. Well, just like Manvi said, within depression, it is not it's not exactly that we here as panelists want to become psychotic in the medical term of the word, but we want to explore and navigate the domains where psychosis is, but also in a controlled manner and protected. So this protection of vulnerabilities is important, and we get protected when we well, in numerous ways. But well, I'm answering your question. Well, madness is not always equal to mysticism. That's and some, yeah.
Anybody else want to say anything about that? Roles and sort of a related one. Somebody's asking, saying, madness tends to be, defined by cultural exclusion or have a lot of cultural exclusion around it. And so, what would it look like if we started becoming truly inclusive and somehow more integrating, madness and mad experience into our culture? Any ideas about that?
I think a lot more people would come forth honestly with their experiences because there's all of these non-ordinary states are so hidden for fear of being cast out or being considered crazy or something. So I think if we were more accepting, I think more people would be coming out of the woodwork and we would understand that this is part of being human. It's not that you're bad or you're sick, but that's part of the continuum of the human experience. I think it would just be more normalized, and there might not be such a special role for people who have these gifts because I think to some degree we all have these gifts and they manifest in different ways. Like someone said in the chat, I can't imagine a normal state of mind. I don't know what that is either. And maybe that's something the neurodiversity movement is pointing to, and maybe that's why so many people are claiming that identity. I don't know. It's interesting. We'll see where it all goes.
Yeah, and then to kind of build on that, I think for me at least, it's very difficult to imagine what that would look like, because it's for the same reason it's very difficult to imagine a world outside of capitalism, a world outside of which, in which my time is structured according to all of these different factors that are completely outside of my control, because I need to, make money in order to survive. And I think we're living in a time period where people are feeling that stress amplified, particularly post COVID and with all the uncertainty around the world, right? Like, I think there are so many things happening in the United States that people want to respond to immediately, that people want to take to the streets and fight back against. And yet we live in a world where we have so little time dedicated to do what's meaningful to us without risking, losing our mortgage or not being able to pay rent as, inflation skyrockets. So, I think for me, that's where the economic piece comes in so clearly, is that like, it really does structure our imagination. So when I was talking about like this concept of normal and how it's used to police, like we think, I think, that we need to be normal in order to be successful, right? Those two things are linked. And so, if we risk losing that sense of normality, then we could risk, putting ourselves in danger, putting our family in danger. And that train of thought can escalate so quickly, it keeps people from doing what's meaningful to them. And so, yeah, like creating a new mental health system, I think also involves creating a new economic system, a new social system in which we're able to support each other in ways that are meaningful. And that it's very difficult to imagine given everything that's going on today.
I think one key thing is just when existing systems and institutions are aware that they only have part of the truth and are a little more humble, then there's definitely more room for that. Hey, maybe there is something, and the outsiders, the people that seem mad, like, hey, maybe they've got something we don't. Not, they may be confused and need help. And I think some people are asking questions about that side of it, because obviously we have people here who've had some bad experiences, but then they've been able to grow from them. But what about the people that haven't, that are on the streets or in institutions or are having, horrible problems? What can we say about that, or how, what, see, I think I lost track of the question a little bit. But yeah, any thoughts about addressing that differently, or even that distinction, that point of like why it goes one way or another?
Yeah, I can only make the small remark that there's a huge difference between the way society in the US is in comparison with Europe, because the correlation between homelessness and being schizophrenic is so high in the US, that it is almost not imaginable that you could live a life as schizophrenic without becoming homeless. And in Europe, circumstances are so much different. The society is so much warmer towards the individual that, well, I think the best thing that in the US could do to help people with mental health problems is on the social level, and a kind of socialist ecological revolution, well, or not revolution or whatsoever, but that the problems are economic or social, as Tim mentions, and that's even different between the US and Canada. Well, not intending that in Europe or in the Netherlands everything is okay and fine, but the problems is a different kind of extent to which the US is a failed nation, so to say.
Yeah, you mentioned warmth. I just wanted to mention one experience I had, and this was in a context of working with some Native American people in this complex thing. But when they were trying to help people get into an altered states of mind, But when they did, they recognized that it was dangerous, that when you open up, you're opening up to unhelpful spirits as well as helpful. But their approach to that was to have, when they saw you go into a really altered state, they would gather around you in this really supportive, warm way. And there was the concept that you might need help, but also that you might be experiencing something that would be a gift to everyone else. And so there was that receptivity and openness at the same time. Hey, we're protecting you. We've got your back. And that just said something about that spirit is what we really need.
Yeah, well, something of that spirit of what you describe is trying to be practiced in, at least in the Netherlands, in so-called recovery groups or peer support groups. And they are partly institutionalized. They are close to the mental health system, and partly not. But well, there are things happening in the Netherlands like that. I think also in the US. But you talked about Soteria House before, and such kinds of initiatives. And in so-called self-help groups, I mean, a group of individuals who are all calling themselves neurodivergent and being disabled, when they're giving care and support to each other, well, that those groups are also in a way outside the system.
Anybody else jump in on that one?
Yeah, I think speaking to survival, I mean, I was talking with a psychiatrist who works with a lot of people in the South Asian American community, and basically she helps people get on medications so they can continue functioning because maybe there is a spiritual gift within these things, within these experiences, but not everybody is ready or willing to explore that. And there are a lot of people that are, in their perspective, suffering and simply want to go back to life. And it is really about survival, being able to work, earn money, get through the day, take care of children and elders. So, I mean, I completely have respect for that too. And the things I'm talking about with the path I've chosen is just my choice. But I would never advocate for that as a blanket statement that everybody needs to be a mad mystic. It's some people, it is the right time and place for them to simply be able to do something that gets them back to functioning in a way where they can survive in these circumstances.
Yeah, and just to kind of add to what you all are saying, I think as things continue to get more and more difficult, both economically, socially, politically, which, I think the trend is obvious technologically, right, with the way that technology is transforming our life. And I think what we're seeing and what Doctor's mentioning is that it's going to be so important for people to support each other outside of standard social institutions, right? The institutions are failing. People are reacting to that failure. And many people are in shock, but other people have seen this coming for a long time. But regardless, in order to move forward, those people who survive this are the ones who will be, working in communities, sharing resources outside the system and supporting each other in ways that are demanded by the moment. And we're seeing, as others have mentioned, these groups popping up all over the world. So there's definitely hope, and we can look to those communities to get some sense as to how to survive this trajectory that we're on. But yeah, I think that's, for me at least, what I see as the only hope.
Yeah, by the way, I apologize that we're not going to be able to get to all the questions. There's like lots of great questions, and this is such a, and we have a whole panel answering, so whatever, but we're doing the best we can. One question for you, Wouter, is that psychosis is often shadowed by significant existential fear, which enables medicalizing exploitation. So how do you see this fear and the psychic social dysfunction it might cause, and how to overcome it? Any immediate ideas on that?
That's a difficult, hard question, difficult question. The existential fear or angst or anxiety, as it is called, which comes free when all structures evaporate, and when you are just looking in this abyss, and when you are in this depressive state, and you're only attracted by the black hole. And when every light that there could be, you already know that it will extinguish, and you're looking towards death and etc. And you are in this fearful mood, so to say. Yeah, that is that is a difficult state or path. And well, I would advise to take a stroll outside, to look at the trees, to look at the sky, to look at the water, and then walk further. That's all we can do.
Okay. Thanks. Here's a question for you, Chris. You mentioned that the younger generation is kind of like maybe more pro mental health labels in the past. And so do you see this as primarily positive, negative, both, or neither?
Yeah, spoke to this a little bit. I would like to think it is mostly positive. Emphasis on mostly. Um, I think as academics, as advocates, as activists, as just people living with madness or experiencing madness, I think it's a necessary step, maybe, in my opinion, for us to get to the point where we've destigmatized these labels. Um, as we're trying to gradually deconstruct our concept of normalcy, of wellness. I think it is a great step towards that. But I also, as someone who uses those labels, I recognize that that is not the end all be all. It is just one step towards the eventual goal of liberating yourself from those labels entirely. I think right now, I think it is positive. Um, from a personal and just relating back to what my peers have said about these labels, I think there's a lot of comfort to be found in acknowledging that we feel different from the norm and that that has become the new normal. Even if it is constricting ourselves within these labels, there's a comfort and community to be found um, in the newer acceptance of being neurodivergent, of being disabled, of having depression, anxiety, of finding commonality between your communities with those labels. So yeah, just a little bit on that.
Um, Well, I'm kind of like noticing we're running out of time. I think obviously this is a really rich subject. That's why, there are the conferences on it. I believe the one in Europe is online, available online. It's, I think, on both online and in person. So you could consider actually registering for that and hearing more of this rich discussion there. Or if you can make it to Toronto, you can catch that one. And we hope to have more discussion here and there. But does anybody else have any like remarks they want to get out in conclusion? Just want to thank.
Yeah,
Thank you to everybody for coming, for listening, for engaging.
Yeah.
I've been trying to multitask and listen and read the chat, and there's so
Same.
many brilliant people who are in
Yeah.
attendance too. Thank you for being here. Thank you for the platform,
Yeah.
Mad in America.
Yes,
So
thank
great.
you, Ron and Zoe, and everybody of the Mad in America community and the Toronto community, so to say. And yeah, I also saw this chat running very fast when someone has a question and is really eager to ask it. Well, you may send me an email. I put my email. Well, I put it in the chat once more.
Yeah, and when Zoe sends out she's going to gather resources that were put in the chat and we'll include it there. So when you get that email, it'll have what are your email? Yeah, so thanks everybody for participating, for sharing, for donating and helping support Mad in America. And also I do invite you to become a regular subscriber for Mad in America, regular donor. We hope to have more webinars of interest. And have a good day, everybody. And we will be sending out the recording, once it's edited. So thanks.
Yeah. Thank you, Ron. Thank you, everyone.
Thanks, everyone. Goodbye.